Neil. We'll be talking about those trees later in the programme. But let us start with those figures on fertility. In England and Wales last year, 591,072 children were born. That's below 600,000. It's a very striking figure because it's the lowest number of live births since 1977. But we're a much bigger country than we were in 1977. And as you've heard in the bulletin, in terms of the fertility rate, the lowest number on record, 1.44. Melinda Mills is Professor of Demography and Population Health and Director of the Leverhulme Centre for Demographic Science at the University of Oxford. Melinda, first of all, let's just put this in an international context, because it does sound incredibly low, but Britain, not really that much of an outlier on this.
Yeah, so I think it's quite important to think about it internationally. So actually, the total fertility rates have been going down in a lot of Western countries and particularly East Asian countries for the last few decades. So areas such as Italy, Spain, they've already reached these really low fertility levels as well. So the UK, England, and Wales is pretty much on par with those. But then we have some extreme cases, such as in South Korea, where it's at 0.7. So these are really low levels. And you have other countries such as Hungary, where it's 1.52. So it's around the range of a lot of Western European countries.
It is extraordinary. You'll hear people say it's all to do with high house prices. So families can't have kids because they can't afford a place to give them the bedrooms that they might want, all of that. And yet, when it's such a pervasive trend across different jurisdictions, you just have to say it can't be explained by one thing. What do you put it down to?
Well, you're right. It's not just one thing, but there are some commonalities across all these different countries. And one, as you mentioned, it is housing. So across Europe at the moment, the proportion of people 25 to 35 living in the parental home is at 50% in some countries. So there definitely is a housing crisis across a lot of European countries. And it's also related to the aging population. So people are living longer and staying in their houses. But one thing that's also universal is women getting higher education and entering into the labor market and staying in the labor market, and then having difficulties combining work with family or having, inaffordable, difficult to reach childcare. And, the other one is economic uncertainty. So people really need to have some sort of, job or house or future where they think that they feel comfortable in having children. And if they don't, they really postpone. So, I mean, what was produced today said the average age for fathers is 33.8. And for mothers, it's almost 31 years. So this is really a shifting in later fertility. And then you're having children where you're biologically less able to have more children, and people are running into more problems as well.
Okay, so it is getting older. Has in your experience, Melinda, has any country managed to find a way of changing it? Because there are a lot of people who say we just have to encourage people to have more children. That's tax or benefits or subsidies. But has anybody actually really managed to jolt it very significantly?
Yeah, so there is a lot of discussion about policies and what works and what doesn't work. There have been some sort of almost akin to randomized control trials in Norway where they showed that if you change childcare availability and also paternal leave, so men are able to take leave and it's culturally acceptable and economically possible, those things seem to work. But there's countries such as South Korea that are throwing billions into this. And think about Hungary as well, who's spending 5% of its GDP currently on pronatalist policies. And there's been quite a few analyses that's showing that this just isn't budging the fertility rates. So
that's amazing. Hungary is. I mean, Orban is absolutely trying to get the population to reproduce more, isn't it? They're spending 5% of their income, their national income on it.
It's incredible. Think about it. They're spending 3% or lower than that on military and defense, and 5% on pronatalist policies. So it's things such as, if you have 4 children, that women would be offered, they'd be tax free. Also, you can take out loans, and after you reach 4 children, then you become, then you can waive those loans. So it's some pretty incredible policies being introduced there.
But they're still not very high. They're still at 1.5 or something. They're about a little bit higher than us, but not material. Yeah.
It's still really low. And then you have this discussion, in the UK about the two-child limit on the tax child credit. And if you add it up, if you have two children, you get 2,200 a year. Is that going to budge people? Are people going to really think about that
Mm.
when they're having children? So sometimes, it's a very complicated policy mix, and it's not always just throwing money at the problem. It's thinking about, do people want to have children? Are they able to have children and combine it with their own life goals?
Melinda, stay there. I want to bring in Paul Morland, a demographer, author of Tomorrow's People, The Future of Humanity in 10 Numbers. Obviously, they're talking about it much bigger than the UK. But Paul, the economic consequences for this country of essentially having an aging population, because the number coming in, if you like, of births is not keeping up with the number of people growing older. Talk us through where we're going as a nation with this.
Well, we've had below replacement fertility rates since the early 70s. And that takes a long time to feed through, of course, because a baby born doesn't enter the workforce for at least 20 years or so. But what we are already seeing, we've gone down from a ratio of perhaps 4 people in work to retiree to 3, we're heading to 2. And what we're already seeing is massive labour shortages, huge pressures from employers on the government, for example, to have more immigration. There's a really important link to the immigration debate here too. And what we're doing now by having this extremely low fertility rate, much lower than it was, but as Professor Mills has pointed out, there are countries much worse, and we could be heading in that direction. We're building up this problem for the future, where we will have more people leaving the workforce than entering it. We will have the government under enormous pressure to provide pensions, to provide healthcare for an aging population, and fewer young people entering the workforce, fewer creative people with new inventions and new patents. And so we've already got a sclerotic economy throughout Europe because of half a century of having too few children. We're just compounding the problem for the future.
It is. So it goes to two working people for a retiree, that kind of ratio.
Well, that's
If you
where
carry
Japan
on.
is
Yeah.
already, and we're heading. And Japan is going to be at 1 for 1 in a few decades, and we'll also get there in due course. And I honestly believe that society will not be able to function. I don't think we'll be able to have the kind of healthcare system, the kind of welfare system we got used to. We simply won't have the labour, we simply won't have the tax revenues. Something is going to give.
I mean, I've seen people say that the public finances, the government's finances get quite bad because we provide a lot of old people services via government, whether it's the NHS or care or pensions. But in a way, if you're down to one old person for one working person, I mean, it doesn't matter whether it's government or private sector. That just is an economy that is not going to find it very easy to do much because.
Yeah, the disastrous finances in Japan, where you've got 250% debt to GDP, so 2.5 times worse than ours, is it's a manifestation of the underlying problem. And as you say, however much money you throw at it, if the people aren't there aren't going to be people to look after the elderly. I mean, there are lots of great reasons to have children. I've had 3 of my own, and I'd encourage it to anybody. But we're looking at the economic problem. It's an economic manifestation of an underlying problem.
Really, really important. Melinda Mills and Paul Morland, thanks so much for just reminding us of what a consequential trend is underway with these figures. Really just confirming, I suppose, what we've known for years, declining fertility rates, but 1.44, the number there, births per woman. Thank you both very, very much.